When it comes to full arch one-piece bridge, I personally prefer cement type restoration over screw type for several reasons. When we examine carefully about any multi-unit abutment design, it has two connections and two screws. The superior connection is cone-shaped and it has very tiny multi-unit abutment screw that can receive about 10 Newton centimeter of torque. The lower connection goes into the implant and it has bigger and normal abutment screw that we can apply 35 Newton centimeter of torque. The bridge is fully retrievable, but it is also possible to have more frequent screw loosening from this tiny multi-unit abutment screws. The cone-shaped abutment is hollow inside, and the multi-unit abutment and tie base interface is not very fluid resistant. Therefore, some patients complain about foul smell, and the most importantly, cement type restoration is easier and more forgiving than screw type restoration. Clinicians can connect implant level scan bodies into implant very easily, and verification radiograph must be taken to see if the insertion was done correctly. This step is crucial, but a lot of clinicians skip this important step. It is absolutely necessary to take the verification radiograph. Taking impression over the scan body is easy. Once the accurate impression is made, we can simply digitize the impression using the micro CT scan. I like using titanium custom abutment. Gold color can be achieved very simply by anodizing the abutment. 30 to 70 micron of cement gap is given on each abutment crown interface, and that space is added up to provide forgiveness. I know that titanium abutment will last for a long time without much complications. And it is not as complex as multi-unit abutment, and the normal size abutment screw are used and torqued with 35 Newton centimeter of torque. Monolithic zirconia bridge may last a long time without much complications. With simple component, it's very cost efficient and reliable as well. Only drawback is retrievability, and some clinicians consider retrievability as a major factor and some does not. There is no right or wrong in this, and we can make judgment case by case.